Can I get some clarity on an issue having to do with Medicare for All? Because you talked about healthcare too. You are a co-sponsor of Bernie Sanders' Medicare for All bill, which essentially will ultimately get rid of private health insurance for everything except for extraneous things like cosmetic surgery. But you have said you favor a health plan that does not do away with private insurance. So are you supporting a bill you don't believe in? I don't understand exactly.
Well, look, again, as a guy who had to run a city that was in crisis when I took it over, you don't let your sort of purity of what you're looking for undermine urgent results needed right now for the people in your community. They don't have time to wait for us to get to a point years down the road. And so I think we have the most inefficient system on the planet Earth. We spend almost 20% of our GDP, about 18%, for the worst results of the industrial nations. We have lots of people taking profits off of the system. Remember, all that expenditures we're doing, trillions of dollars, are not going to patient care. We have a system that's designed more towards the back end of problems when they're more expensive, the hospital emergency room, dealing with things when they come acute, not dealing with them in the preventative care, early detection. Early intervention. So this system is broken.
Right, but do you support Medicare for All?
I stand by supporting Medicare for All, but I'm also that pragmatist that when I'm chief executive of the country, like I was, I'm going to find the immediate things that we can do, because I'm telling you right now, we're not going to pull health insurance from 150 million Americans who have private insurance, who like their insurance, my union brothers and sisters who have negotiated for their health insurance. It's going to have to be a pathway to getting there that's going to start with the common sense things that can unite Americans.
With all due respect, Senator, that's not what this bill does that you co-sponsored.
And Jake, we're friends long enough to say that whenever you start something with all due respect,
you know it's trouble.
I know it's trouble.
Well, the text of the bill says, quote, "It shall be unlawful for a private health insurer to sell health insurance coverage that duplicates the benefits provided under this act." And I just wonder, look, you favor a pragmatic approach that doesn't go that far. And I just wonder, did you feel pressure from liberal and progressive activists? Oh, you need to sign up for Medicare for All when you didn't actually believe in it?
Look, guy that stood in the saddle under the most difficult conditions and made change because I don't bend to pressure. I focus on people. In America, healthcare should be a right. That is where we need to go to. And by the way, most Americans agree that if you're in this nation, as the wealthiest country on the planet Earth, it should be a right. Now, there's many ways that we're going to get there. I believe if we're designing our system, Medicare for All is the right way to go. But I'm also realistic to say, and you know this, when I become president, we may have only maybe a 50-50 tie in the Senate. And my vice president, whoever she is going to have to get a lot of exercise going to the Senate and breaking ties. We are going to have to do things that get me towards my goal of expanding access and lowering costs.